Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director for the Institute, along with Dusty Rhodes here on Healthcare Consumerism Radio. Would like to introduce our next guest, who is co-founder and Chief Energizing Officer and her name is Danna Korn. She is with Sonic Boom Wellness. Welcome, Danna.
Thanks for having me.
And you're joining us from the West Coast, is that right?
I am. It's a beautiful day out here in Southern California.
Oh, that's awesome. Well, I hope you're looking forward to a good weekend. Now, tell us a little bit about Sonic Boom Wellness.
Well, Sonic Boom is a corporate wellness program, and when we started out with this idea, it came back in the mid-2000s or so, and everybody in corporate wellness was going the same direction. They were doing biometrics, coaching, and health assessments. And we were finding that engagement was really low. I mean, what a great idea to bring wellness to the work site, and yet nobody was doing it. Nobody was taking part. And so we decided that we would make it fun. We figured the reason people aren't doing this is because it's not fun. And the other thing is it's not really changing daily habits. So great, you know your numbers. You got your biometric screening. Now what? So we decided to be the now what part of this formula. So we focused at first on engagement. We came out of the gates in 2007 singing engagement, let's make this fun. And we did. We made it fun. We got great engagement. But we quickly realized that we needed to bring in our serious side as well, that there was a purpose for biometrics and coaching. And so we are able now to tie that serious side in with the fun gamification of wellness and really drive engagement, but see some massive results as well.
Now, the gamification piece, that's very interesting. I mean, that's something that I think employers are really gravitating towards from a standpoint of engagement, because you're right, engagement was something that employers were struggling with. With corporate wellness, why are companies paying for an offering like Sonic Boom Wellness?
Well, they're paying for wellness in the first place just because it's become a business imperative. Their healthcare costs are skyrocketing. It's killing them. And they're never asking people to take accountability. So here we're paying $7,000, maybe $10,000 a person for your health care benefits, and we're not even asking you to quit smoking? Are you kidding me? So now employers are saying, hey, you know what? I'm going to give you these great benefits, but you're going to have to take some accountability too. You're going to have to maybe get your biometrics done, but let's change your daily habits. Let's improve those daily habits, and that's where Sonic Boom comes in, because as I said, knowing your numbers, that's great, but then you get to the now what? How do I change it? We all know the right things to do. We all know you should eat right, you should exercise, blah, 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 blah. How do you stay motivated? How do you hold each other accountable? That's where the gamification really plays a strong part.
Now ACA, has some incentives in it for corporate wellness. Is that right?
It does have some incentives, especially for small employers. It also has changed the way that people can do their incentives in terms of the amount of the incentive that they can provide, which is a great thing. Not a lot has changed in the way we're going to have to drive people to take part, and that engagement piece that we focus so much on, that hasn't really changed. But now people can be rewarded more for actually doing the right things. Yeah,
now we always talk through the Institute for Healthcare Consumerism is how does an employer empower their employee population to become that better consumer of health and healthcare, and wellness is a big piece of that. And I think a few years ago, a lot of employers had a little bit of a pushback on wellness programs. Do you see that? Do you see that starting to change because they're starting to see some data points that encourage that wellness program maybe doesn't need to be on the chopping block?
Yeah, absolutely. I think what we've seen, even during the really hard times, 2008, 2009, we saw that businesses saw this as a business imperative. They know that their healthier employees are happier employees, they're more productive, they're absent less. I mean, intuitively they know all that, but they are starting, as you said, to see those data points. They're starting to see ROI numbers, a lot of which I've got to say I'm not a huge fan of ROI numbers because there's so much smoke and mirrors involved there. But they're consistent, that you consistently see a 3-to-1, 5-to-1, even some people say a 12-to-1 ROI for the money that you put into wellness.
Now there's, as you look out at the market today, it seems like there's a new wellness provider, popping up weekly, and what's, from hearing you talk, I see that you guys are building out and focusing on the engagement piece and bringing in the gamification piece, which I think is unique. Are there some of the things that are going to separate you from the competition out there? Or are there other things that you guys have in the works that are going to separate you from competition?
Yeah, I think what we're seeing in the wellness world is a polarization. So you see the old school wellness, and I don't say that pejoratively. I'm just talking about biometrics, coaching, and health assessments going over to one side. And now you see all this gamification popping up on the other side. What makes us different is that, number one, on the gamification side, we have lots of games. Most of the game companies only have one, and it revolves around physical activity. And I liken this to going to Disneyland, and if you only have one ride at Disneyland, it could be the greatest ride on the planet, but if you only have one ride, it's going to get boring. The sustainability is the holy grail in wellness. So we've got lots and lots of games well beyond physical activity. We've got optimal nutrition. We've got a lot of stuff going on to keep people engaged and to keep them interested. But the other thing that we're doing differently is while you see this polarization going old school and gamification, we've been able to bring both sides together. So in an incentive platform, for instance, you can still, even though we're gamification and engagement, we can still say to the employee, you need to do your biometrics. If you are in a disease management program, you need to complete 4 disease management sessions or coaching sessions. So we can bring that serious side in, and we have the gamification and engagement side, and we can create this one super comprehensive and extremely effective package.
Now, with the emergence of all the technology out there, tablets, smartphones, do you guys integrate your platform within those devices?
We do. In fact, we're just coming out with a brand new look and feel that's going to be especially good on all the devices. So it'll work on any device. It's optimized to work on iPads, iPhones, Androids, Blackberries, absolutely any device. And we find that is really helpful because that was one of the barriers to wellness in the corporate environment was what do you do with manufacturing people, distribution centers, people who do not have full-time access to a computer, truck drivers, for instance. So what's really cool is we can engage them. We've got a pad they can wear that they can wear with or without a computer, so they're getting credit for their activity and all of their physical activity, even if they're not sitting in a computer. So yeah, absolutely, the mobile technology has been a big part of our game plan.
Now, if tell our audience a little bit, can you go directly to an employer and work with them? Would you work with a health plan, whether it's on a national or regional standpoint? Do you try to talk to TPAs who, from our standpoint, TPAs are really building out all their solutions because of the growing number of self-funded companies emerging in the market? So who can you serve with your products?
Yeah, all of the above. What we're finding is, for a long time we were going through the insurance industry, so we were going through brokers and consultants, and that's an awesome distribution channel for us, and especially right now because they're having to prove more value. Frankly, they've got a commodity to sell, and they're having to prove more value, and one way they can do that is to say, hey, we have the very coolest wellness program that'll be perfect for your environment. So we still go through them. A lot of health plans. We're talking with a lot of health plans. We are talking with TPAs because, as you say, they, too, are building out the ultimate solution, and self-funded companies really love the idea of wellness. They've got a lot more to gain from getting people healthier.
Right. Now, the exchange market, if you look at all the private exchanges, the public exchanges are there, but we kind of don't know what that's going to look like quite yet. Do you see a role for your product inside of these private exchanges that are exploding on the market?
Yeah, absolutely. We have been talking with some of the private exchanges that are building out right now. I think there's still so much that they don't know, which is why we haven't jumped into that pool quite yet. There are some other wellness companies that have. We just feel like we want to sit back a little bit, learn a little bit more about what this is going to evolve into before we dive both feet in. But they're absolutely talking to us because, again, they've got a lot to gain by keeping people healthy. Right.
You're right. Now, some of the, as we look at the health and wellness space and ACA, can you kind of look into your crystal ball and where do you see the market, let's say, 12 months from now, 18 months from now?
Well, I think it's going to do nothing but grow stronger and stronger as people really believe and see the results and know exactly how important it is to keep their employees healthy. And as they start seeing a true ROI on this, I think you're going to see this wellness business get stronger and stronger. You're also probably going to continue to see, as you pointed out earlier, a lot of wellness companies popping up, here and there, but not necessarily doing a great job, maybe trying to be a Me Too company. So I think what we're going to see is while they pop up everywhere and they go to both sides of that polarization I was describing, you're also going to see a lot of fallout, a lot of condensation. I think people are going to start buying up each other. and you'll see a lot of consolidation in the marketplace. So it's going to be an interesting next few years for sure.
Yeah, definitely. And as we work through ACA, I'm sure everyone's kind of on their toes right now, trying to react to everything. Now we got about a minute and a half left. Kind of give our audience a couple takeaways that you want them to really understand about Sonic Boom Wellness.
Well, I think it's one of the most important things is that Sonic Boom is not a great match for every company. We have an out-there approach. We ask our clients to let their employees have fun while they're getting healthy. So sometimes we're approached by a stodgier company who says, nope, we just don't want people, I don't think our people will do that. We don't want them getting challenges every day. That's not a great match for Sonic Boom. We want people to be having fun. What they don't realize is that people want a chance to be a little bit silly at work. I don't care if you're a lawyer, if you're a surgeon, I don't care what you are. You want a chance to be a little bit silly from time to time. The other thing is that it has to be sticky. And the only way to make a wellness program sticky is by giving people an epiphany or by giving them something, an aha moment that makes them say, wow, I didn't know that, or gee, this is really fun. That's the only way it's going to stick. So creating that social networking, that bond, and the emotional connection with your program, as well as with the players, that's what really works. That's what keeps people involved. We've got people who have been involved in our program for 3, 4, 5 years, and they keep going strong because of all the different complexities, that social networking, the stickiness, the epiphanies here and there, and the fun factor. That's what's really huge with Sonic Boom.
Now, Danna, what's the website where everyone can find you guys?
It is sonicboomwellness.com.
Well, Danna, thank you so much for joining us on Healthcare Consumerism Radio. We really enjoy having you on the program. And to our audience out there, signing off for this week. We'll be back next Friday with Healthcare Consumerism Radio. To everyone, have a great weekend.